Welcome, dear friends. Today we are going to learn about meningitis. The objective of this topic is that upon completion of this topic, the students shall be able to describe the etiology and pathogenesis of the meningitis, name the sign and symptoms of the disease, mention the complications of the disease. The outcomes are going to be the student will be able to suggest diagnosis and treatment, can suggest preventive measures, and can create public awareness about meningitis. Now, let us take a minute to think about what we all know about meningitis. Now, let's take a look at to what is exactly meningitis. Meningitis, it is an acute inflammation of the meninges. Meninges is the protective membrane which covers the brain and the spinal cord. Meningitis comes from a Greek word which is made up of two words. The first one is menins, means the membrane, and the suffix itis stands for inflammation. So meningitis is nothing but it is the inflammation of the membrane which covers the brain and the spinal cord. Now let's take a look towards where these membranes are actually reside in the body. This is your skull, and at this point comes your dura mater. Next comes your arachnoid matter, and last is the pia mater. This pia mater is in direct contact with your brain. It is directly going to cover your brain. The arachnoid matter and the pia mater, they are togetherly called as leptomeninges. Now inside this arachnoid matter and pia mater, there forms one cavity called as subarachnoid space. That subarachnoid space consists of CSF. Now CSF means cerebrospinal fluid. The CSF is essential for maintaining the nutrient balance. It provides the nutrients to the brain cells. Also it helps to take out the waste material. Also it is going to prevent, or it is going to protect your brain from shocks, and it resists the damage to the brain. So that is the function of the CSF. The inflammation of the meninges is mostly caused by the virus or bacteria or other microorganisms, and rarely it is caused by drugs. Now the drugs which are directly given intrathecally, they are responsible for causation of meningitis. The bacterial inflammation is less severe, and the death rate is also 15% less. The most dangerous or the severe form of meningitis occurs due to viral infection, and viral infection is the most common cause of meningitis. Life threatening, and as meningitis is life threatening, it is also termed as medical emergency. Around 9 million people suffer from meningitis. Together with sepsis, meningitis is estimated to cause more deaths in children under the age of 5 years as compared to malaria. Its outbreaks occurs in the sub-Saharan African part from December to June, and hence it is called as meningitis belt. Now what this inflammation of meninges is going to cause? It causes fever, very high fever, headache, and it also is responsible for causation of stiffness in the neck. What are the risk factors for meningitis? The first one is skipping vaccination. As we all know that nowadays a lot many vaccines are developed, and right from the birth we give lot many vaccines. Out of that, one vaccine is included for meningitis. If you miss that child dose of your vaccination or the adult dose of the vaccination, then there is a chance that you might suffer from meningitis. The second cause is age. Mostly the children who are below the age of 5 years, they are most likely to get affected with meningitis. Secondly, the reason is living in community setting. That is, whenever you live in community setting or you live in military schools or boarding schools, at that time the chances of suffering are increased. The chance is also increased during pregnancy, because when a lady is pregnant, there is a chance that she will suffer from listeriosis. Okay, it is a condition, it is an infection. If she is suffering from listeriosis, then she might give birth to stillbirth babies, or she might undergo miscarriage, or she might prematurely deliver that baby. Now when the baby is prematurely delivered, there is a chance that due to that listeriosis, the baby will be suffering from meningitis. And lastly, it occurs in the patients who have compromised immunity. Now the immunity is compromised in case of the patients who are suffering from AIDS, HIV, or the people who have undergone an organ transplant, because this patient, they are on some drugs which reject which do not allow the body to reject the organ transplant. Okay, so it is going to compromise your immune system, and in this cases there is chance that the patient will suffer from meningitis. Now let us take a look towards the symptoms. The symptoms can be divided as based on the age of the child. Okay, now when the child is above the age of 2 years old, the child will show the symptoms as severe headache, confusion, difficulty to concentrate. Also the child will experience stiffness in the neck, inability to flex the neck due to increased muscle tone and stiffness. The child will also suffer from photophobia. Now photophobia is intolerance to the bright light. Also the child is going to suffer from phonophobia. Phonophobia is intolerance to loud noise. Also, if the condition is not treated in time, there is a chance that the baby or the child will suffer from seizures. The child will also experience nausea and vomiting. Okay, so these also there might occur purple colored skin rash. So these are the changes or the symptoms which are experienced by an 2-year-old child, or the child who is above 2 years of age. Now let us see the symptoms which are experienced by the newborn babies or the infants. The first thing is the baby is going to suffer from severe fever, chills. He might be irritated, he might constantly cry, there is inactivity or sluggishness, there is poor feeding, there is a bulge in the soft spot on the baby's head, that is called as fontanelle. There is also stiffness of the body and the neck. Now let us take a look towards two symptoms or two signs. The first is Brudzinski's sign. What happens in this condition? Whenever you take the baby for diagnosis or to the physician, at that time the doctor, he will make the baby lie down on the surface, flat on the surface. Then the doctor will flex his neck. Now due to the stiffness which occurs due to meningitis, the baby is unable to flex the neck, and when the neck is flexed, simultaneously he is going to flex his hip and knee. Okay, if the baby is not suffering from meningitis, then he can easily flex the neck without flexing his knees and hips, but this is not happening in the case of meningitis. Whenever a baby who is suffering from meningitis, we flex his neck, at that time automatically his knees and his hips also get flexed. Now this occurs due to the stiffness in the neck. So this is called as Brudzinski's neck sign. The second sign is the Kernick's signs. Now what is going to happen in this case? The doctor again asks the baby to lie down flat on the horizontal surface, and he slowly uplifts his one leg. First he will uplift it to make a 90 degrees of angle, and then slowly this angle he is going to increase. Okay, now when the angle is increased slowly above 90 degrees, at that time the child, he experiences severe pain and he cannot flex his leg above 90 degrees. Okay, so if the baby complains that he is feeling pain, then it is a sign that the baby is suffering from meningitis. So this is called as Kernick's sign. Now let us take a look towards the etiology. Meningitis is typically caused by an infection with microorganisms. Most infections are due to viruses with bacteria, fungi, and protozoa. The bacterial agents include, in the neonates, the reasons are E. coli, group B streptococci. In the infants, the reason is Haemophilus influenzae. In adolescent and young adults, the responsible agent is Neisseria meningitidis, which is the most common cause, and Streptococcus pneumoniae. In case of elderly, the cause is Listeria monocytogenes, Streptococcus pneumoniae. The viral agents include enterovirus, which is the most common, mumps virus, Coxsackie virus, HS7 virus, EBV virus. Okay. In fungal agents include Candida albicans, Cryptococcus neoformans, Blastomyces dermatidis, Coccidio decimatidis. The parasites include protozoa, nematodes, Casterdo. Non-infectious causes include cancer, which migrates towards the meninges, NSAIDs, antibiotics, IV immunoglobulins, etc. So this was the etiology. Now let's take a look towards the pathogenesis of bacterial meningitis. The bacteria, it is going to enter your body through the nasopharynx. After that, it will colonize the nasopharyngeal epithelial cells. Then there occurs local invasion into the intravascular space. The bacteria gets transported across the epithelial cells in the membrane bound vacuoles or by creating separations in the apical tight junctions. After that, there occurs bacteremia, that is, the bacteria, it avoids phagocytosis because of the presence of the lipopolysaccharide capsule. Then it is going to reach towards the choroid plexus. Now choroid plexus, it is responsible for secreting and carrying the CSF. From here the CSF is carried to the subarachnoid space. Now once your bacteria is going to reach this choroid plexus, automatically the bacteria is gaining access into the subarachnoid space. So the bacteria gains access to the CSF and there occurs rapid multiplication in the CSF. Then there occurs the WBCs which are present in that part. They are going to cause bacterial lysis, that is breakdown of the bacterium. The large scale inflammation which results in meningitis that occurs in the subarachnoid space during meningitis is not a direct result of the bacterial infection, but can rather largely be attributed to the response of the immune system to the entry of the bacteria into the body or into the CNS. Okay, so when the components of the bacterial cell membrane, they are identified by the immune cells of the brain, they respond by releasing large amount of cytokine hormone like mediators, recruits other immune cells and stimulate tissues to participate in an immune response. The blood brain barrier, it becomes highly permeable and it leads to vasogenic cerebral edema, that is swelling of the brain due to fluid leakage from the blood vessels itself. Next, the large number of WBCs enter the CSF causing inflammation of the meninges which leads to interstitial edema. In addition to this, the walls of the blood vessels themselves become inflamed, that is called as cerebral vasculitis, which leads to decreased blood flow, and a third type of edema which is called as cytotoxic edema. The three forms of the cerebral edema lead to increased intracranial pressure together with the lowered blood pressure which often is encountered in acute infection. This means that it is harder for the blood to enter the brain and consequently brain cells are deprived of oxygen and undergo hypoxia, and due to hypoxia it results into apoptosis, that is programmed cell death. Now let us take a look towards the complications. Meningitis complications can be severe. The longer the child has the disease without treatment, the greater the risk of seizures and permanent neurological damage, which includes hearing loss, memory difficulty or memory loss, learning disabilities, brain damage, gait problems, seizures, kidney failure, shock, and ultimately death. Now let us take a look towards the diagnosis. The examination of the cerebrospinal fluid, that is CSF, by using lumbar puncture. You can see here the patient is allowed to sleep on one side and a puncture is made in between lumbar 3 and 4 and the CSF is withdrawn from this part. Before doing this procedure, anesthesia is given to the patient. Then The CSF, it is to be examined in every patient in whom the clinical findings are consistent with even the possibility of meningitis, no matter how minimal the manifestations are. Now you have to examine the CSF for, first is the pressure. Once you take out the CSF, at this point you can calculate measure the pressure. In normal patients, normal person, the pressure is between 6 to 18 mmHg. But if the person is suffering from meningitis, this pressure is increased about above 20 mmHg. You have to check for its appearance, if it is clear or turbid. In normal cases it is clear, but if it is infected, then it becomes turbid. You have to go for wet mount. You can also go for gram staining for the bacteria, stain for presence of neutrophils or lymphocytes or RBCs. You can also go for cell counting. In normal CSF, 1 deciliter contains 1 microliter contains 5 cells, 5 WBCs. But if the CSF is infected, this count is highly infected, above 5 cells per mm cube. Then you can go for glucose measurement. Normally the CSF, it contains 60% of the blood glucose, okay. But when the CSF is infected or the person is infected, in this case the level of blood glucose is reduced below this 60%. Then you can also go for measurement of the concentration of proteins. Normally it is in between 60 to 40 milligrams per dl. It is highly increased in case of bacterial infection. It is the concentration is reduced in case of tuberculosis infection, and it is very less in case of viral infections. Then you have to look for bacterial antigens in the CSF by using specific antibodies. You can also go for culturing the CSF for bacterial growth. What is the treatment for meningitis? You have, if it occurs due to bacteria, then you have to go for antibiotics, mostly penicillin and cephalosporins. These are given by IV route. If it is caused by viral infection, then you have to go for antiviral drug, mostly acyclovir is used. Then you have to use antifungal medications in case of fungal infection. For reducing the inflammation, you have to use steroids, urea or mannitol. For correction of the fluid and electrolyte deficiency, you have to go for correction of that things, okay. To treat seizures, you have to give drugs accordingly. Now let us take a quick recap or summary of meningitis. Meningitis is acute inflammation of the meningitis, and it is a medical emergency. The symptoms include high fever, headache, stiffness of the neck, photophobia, phonophobia, seizures, and ultimately death of the persons. The causes are viruses, bacteria, fungi, parasitic infection, or non-infectious causes. The pathological agents, they enters the blood through the nasopharynx, and the large scale inflammation that occurs in the subarachnoid space during meningitis is not a direct result of the bacterial infection, but can rather largely is attributed to the response of the immune system to the entry of the bacteria into the central nervous system. So the components of the bacterial cell membrane, once they are detected by the immune cells of the brain, they respond by releasing large amount of cytokine hormones like mediators, and which are responsible for recruiting other immune cells and stimulate other tissues to participate in the immune response. The blood-brain barrier becomes more permeable, leading to vasogenic cerebral edema. Also, large number of WBCs enter the CSF, causing inflammation of the meninges, leading to interstitial edema. In addition, the walls of the brain cells themselves become inflamed, which causes cerebral vasculitis, which leads to decreased blood flow to the brain cells, and ultimately it causes hypoxia and apoptosis of the brain cells. Now the diagnosis includes, you have to go for lumbar puncture, and by doing that you can take out the sample of CSF for examination for glucose, pressure, WBCs, proteins, turbidity, and culturing purpose. The treatment includes antibacterials, antifungals, antivirals, steroid, fluid and electrolyte correction, and anti-seizure drugs. So this was all about meningitis. Now let's solve a quiz on meningitis. In neonates, dash is the common cause of meningitis. E. coli, group B streptococci, both A and B, none of the above. The answer is C. In dash, neck stiffness causes patient's hips and knees to flex when neck is reflexed. The answer is Brudzinski's sign. You have to go for true and false. In meningitis, death of brain cells occurs due to hypoxia. True. In meningitis, glucose level in the CSF is reduced. True. You have to go for match the following. Vasogenic cerebral edema, it is caused due to increased permeability of the BBB. Interstitial edema, it is caused due to inflammation of the meninges, and cytotoxic edema is caused due to inflammation of the brain vessels. Okay, so this was the quiz. Now again, so this was all about meningitis. Thank you.